We will learn every relevant medical fact about bladder pain in this video. The urinary bladder is a hollow, balloon-shaped muscular organ in the middle of your pelvis that stores urine. The bladder expands and contracts as it fills with and empties your urine. Your bladder is a component of your urinary system that receives urine from your kidneys through two slender tubes called ureters before releasing it through the urethra. Men and women can both experience bladder pain, which can result from a variety of illnesses, some of which are more serious than others. Investigations are necessary for any type of bladder pain, since there are many potential reasons, ranging from a urinary tract infection to chronic bladder inflammation. A urinary tract infection, which can affect any section of your urinary tract, including the bladder, is the primary reason for bladder pain. Urinary tract infections can affect both men and women, but women are more likely to have them. Bacteria that pass via the urethra and enter the bladder bring on urinary tract infections. Urinary tract infections can spread to your kidneys and bloodstream if they are not treated, which can result in life-threatening problems. A urinary tract infection may also produce lower abdominal pain, pelvic pressure, murky urine, and blood in the urine, in addition to painful urination. By analyzing your urine sample for bacteria, white and red blood cells, and other particles, you can determine if you have a urinary tract infection. In order to identify the sort of bacteria, we could also perform a urine culture. Your doctor might advise further testing to look for abnormalities in your bladder or urinary system. If you frequently get urinary tract infections, these examinations could involve cystoscopy, CT scan, MRI or ultrasound. Oral antibiotics are used to treat urinary tract infections in order to eradicate the germs. A lengthier course of antibiotics may be necessary if you frequently get urinary tract infections. Interstitial cystitis is the second common cause of bladder discomfort. Strong urges to urinate, frequent urination, burning or pain when urinating, pain in the bladder, pelvis or abdomen, painful sexual activity, and pain between the vagina and the anus in women, or between the scrotum and the anus in men, are only a few symptoms. Interstitial cystitis, commonly known as bladder pain syndrome, is a long-term illness that results in painful urine symptoms. Interstitial cystitis mostly affects women, although there is presently no known cause for the disorder. Certain things including infections, physical or mental stress, dietary changes, bladder injuries, or specific drugs might cause symptoms to appear. Interstitial cystitis symptoms vary from person to person and can be moderate to severe. A medical history, a pelvic exam for women, a prostate exam for males, urine analysis, renal function tests, a potassium sensitivity test, and a cystoscopy to visualize the bladder lining are among the procedures used to diagnose interstitial cystitis. Interstitial cystitis cannot be treated with a single, established method. Changing one's living choices is the first step in trying to treat it. These frequently involve altering one's diet, giving up alcohol, and smoking. Medication is the next action. Tricyclic antidepressants are one class of prescription drugs that may assist to relax your bladder and block pain. The next phase is physical therapy, which can help you strengthen and relax your pelvic floor muscles so that your symptoms may be lessened. The fourth step of treatment is bladder installation, which involves injecting a small amount of liquid into your bladder and holding it there for 15 minutes before releasing it. This liquid contains a painkiller to help with irritation. Weekly repetitions of this procedure are possible for 1 or 2 months. Stretching the bladder by putting fluid inside of it is the fifth phase of the treatment. To help you withstand the stretching and hold the fluid, you will be given medicine. Surgery is the final option for treatment and is only advised if all other options have failed and your symptoms are severe. A cystoscopy to remove the bladder, bladder augmentation or enlargement, or urinary diversion to restore urine flow are all possible surgical procedures. Bladder cancer is the third reason for bladder pain. When bladder cells proliferate uncontrollably, bladder cancer develops. Although there are several different varieties of bladder cancer, the most prevalent one is urothelial carcinoma, often referred to as transitional cell carcinoma, which starts in the urothelial cells that line the bladder. Men are more likely than women to develop bladder cancer, and it often strikes those over the age of 55. Additionally, smokers are 2 to 3 times more likely to have it than non-smokers are. The most frequent symptom of bladder cancer is painless blood in the urine. The majority of the time, bladder cancer shows no symptoms at all. However, if symptoms are present, they may include the need to urinate urgently, frequent urination, pain or burning when urinating, and a thin urine stream. Urine analysis, urine culture, cystoscopy, urine cytology, urine tumor marker testing, imaging tests, and biopsy are all possible tests for bladder cancer. The type of bladder cancer, the stage of the tumor, and other circumstances will all affect how it is treated. Surgery, radiation, chemotherapy, and/or immunotherapy are frequently used in combination to treat bladder cancer. After going over the primary causes of persistent bladder pain, we must point out that women are more likely to experience bladder discomfort than males. This is probably because women are more prone than males to experience the two most typical causes of bladder pain, interstitial cystitis and urinary tract infections. It might also be because the bladder directly touches a woman's reproductive organs, which could irritate them and make symptoms worse. The rectum and vagina, where the bacteria that cause bladder infections reside, are also closer to a woman's urethra. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.